Webinar 3, moving forward, next steps. Surveillance. So it's very important not to skip your scans. The first 2 years, you want to scan every 3 to 4 months of the pelvic, abdomen, and chest. Then if you don't have tumors, after 2 to 3 years, you scan every 6 months. And after 5 years of no tumors, you scan annually. Discuss long-term surveillance with your doctor because LMS has been known to recur even 10 to 12 years after remission. Common imaging for LMS. Most of us get CT scans. The best imaging for body parts that move like lungs and the digestive tract. Sometimes your doctor will order a PET scan. Those will highlight a high-grade and actively metabolizing tumor that is 7 millimeters or larger. But low-grade tumors will not pick up. Sites of inflammation and infection will also be highlighted. And then there's MRI scans. Those are best for imaging brain, soft tissue, bones, and limbs. Unfortunately, a lot of us suffer from scan anxiety right before a scan. We've got some tips from our other patients on our online support group. 1, schedule your follow-up doctor appointment first. Then schedule your scan a few hours earlier to reduce the wait time for results. Tell your friends about the scans after you have them, not before, so they don't bug you over and over before you have your scan. Go to your happy place, literally and figuratively. Take Ativan. Always have a plan B throughout to help you feel in control. And distract yourself. Stay busy. Meditate and calm your mind. The issue of biopsies comes up. The problem with biopsies is they can miss a tumor altogether. They may not get enough tumor for a diagnosis. They might loosen cancer cells to flow through the bloodstream or the lymph system, causing more tumors at new sites. They can drag the cancer cells and seed the path of the needle, causing more tumors. And there are occasions when you must take these risks. Discuss with your doctor the necessity to biopsy a tumor. Testing your tumor. So after you have a surgery, they save a little bit of your tumor in what they call a paraffin tissue block, as you can see in the picture. They keep that paraffin block 5 to 10 years. A tumor that's about 6 by 9 centimeters will yield about 20 blocks. And from one block, 200 slides can be made. Consider donating a block to our LMS tissue bank. What to test for? Hormone receptors. If your tumor originated in gynecological areas, ask your doctor to order hormone receptor testing. They'll stain a slide from your tumor and estimate what percentage had estrogen or progesterone receptors. If your tumor is positive, that means estrogen is encouraging the growth of your LMS cells. So you want to block the estrogen your body is making still after menopause with aromatase inhibitors, or AIs. If you are not menopausal, discuss other ways to block the estrogen, including surgery or the use of Lupron. So see the special number 7 webinar on uterine LMS for research to discuss with your doctor on this. Genetic profiling. You can now order genetic profiling on one of your paraffin blocks to identify your tumor's own DNA alterations. The next step is to match those mutations with existing chemotherapies or immunotherapies which are effective for your specific tumor. There are a few places to get this profiling. Foundation One is very popular. Caris and Intermountain are a few commonly used. Your doctor makes the referral and has your paraffin block sent. Many insurances pay for this testing. Okay, let's summarize. Surveillance with scans is critical to catch your tumors when they're small. Follow the NCCN guidelines for surveillance. Those are the ones I outlined to you. Manage anxiety with self-help strategies we listed. Biopsies can seed tumor cells. Discuss the necessity to take this risk. You can ask for tumor testing on your stored paraffin blocks. A paraffin block can yield 200 slides for testing. and you're likely to have 10 to 30 blocks from your tumor. Donate a paraffin block to our LMS tissue bank. See the website for details. If your tumor was uterine or gynecological in origin, have it tested for hormone receptors. If positive, see webinar 7 on uterine LMS. Ask your doctor to make a referral for genetic profiling of your tumor to see if any approved drugs on the market might be indicated